So what is mandible contouring? Well, the mandible is otherwise known as the jawbone, and this can be contoured to various shapes, mostly to narrow the back of the jaw, but also to shorten and narrow the chin. I do this through incisions inside the mouth and use a device called a powered rasp, which looks like a nail file on a motor. I use that to actually sculpt the bone and take off some of the outer layers of the bone to narrow and reshape into more of a V shape instead of a square shape. Most people that want mandible contouring have a very wide jawline, and so I focus on the back here and right in the front, and then the middle part is just contoured to have a smooth transition between those two areas. Some surgeons will do the same procedure but use a drill or a saw, and I've just found that I've seen higher complications using those techniques, and the powered rasp technique actually, it takes a little longer, but I can fine-tune the shape without damage to any nerves or blood vessels in the way. So who is a good candidate for mandible contouring? Well, the jaw can be wide from a number of reasons. One can be from the soft tissue overlying the bone. So there's a muscle in the back of your jawline called the masseter muscle. If you're a teeth clincher or have TMJ issues, sometimes this muscle can be really big. So I usually test that out by getting my patients to clench their teeth, and you can actually feel the girth of the muscle. If it's just the muscle that's creating a widening contour, then I can actually inject Botox or Xeomin or Dysport in the muscle itself to shrink the back of the jawline. If it's the actual bone that's wide, then mandible contouring is really a better option, because any kind of Botox, either whether it's in the masseter muscle here or in the muscle in the front called the mentalis muscle, that's not really going to change the contour. You can also try to narrow the chin using fillers or an implant, but again, that may not provide the narrowness that you need because you're adding material in instead of taking it away. Recovery after mandible contouring is actually really difficult, and that's compared to many other procedures that I do. It's probably one of the hardest recoveries. It's not that you have a lot of pain afterwards, it's that you have a lot of swelling. I don't see a lot of bruising either, but the swelling makes it hard to eat, makes it, hard to talk. I have started giving steroids after this surgery just because of the swelling, and that's just because there are very large muscles that surround the jawline. You'd have an incision inside the mouth that you have to keep clean, and sometimes that can pull away because of swelling. And so I usually recommend a water pick system to clean out those grooves. And of course, I'd have you keep your head elevated and with a compressive wrap around your jaw and head, at least a week, but usually most patients need that wrap more than that, at least 2 weeks, and then at night for about a month. So after a month's time, you'll still see that your jaw is swollen, but to the point where you can go out and about in public and people won't notice that it's swollen. And you don't see your final results for at least a year. So it takes a long time for you to really see the final results from mandible contouring, but well worth it once those results do come out.